Hi, my name is Shannon Brackney and I'm a NOVA DPT student. Do I have your permission to palpate a few structures on you and record this for educational purposes?
Yes.
The first thing I'm going to be palpating is the 5 metacarpal joints. On the thumb, you have the first metacarpal joint, following it distally. So here's the first metacarpal joint. The second metacarpal joint. The third metacarpal joint. The fourth metacarpal joint. And the fifth metacarpal joint on the pinky. Next, I'm going to palpate the metacarpal phalangeal joints. This is the first metacarpal phalangeal joint, the second metacarpal phalangeal joint, the third metacarpal phalangeal joint, the fourth metacarpal phalangeal joint, and the fifth metacarpal phalangeal joint. The next structures I'm going to be palpating is the CMC joint and the trapezium. To find the CMC joint, I'm going to follow the metacarpal joint down proximally, and I'm going to move that joint. Proximal to that is the trapezium. I'm going to have the patient move her thumb into flexion and extension, and here I found the joint space. This area where my thumb is right here is the trapezium, and right here is the CMC joint. The next structure I'm going to be palpating is the lunate. To find the lunate, I follow the radius down, find the Lister's tubercle, and feel for that indentation. That indentation is the lunate. For the capitate, I'm going to flex my patient's hand, and the capitate pops right into my fingers. The next structure I'm going to be palpating is the pisiform, which I can palpate with my thumb or my fingers, and it is right here, this pebble-like structure. Next, I'm going to palpate the triquetrum, which is best palpated by a pincer grip. I'm going to go beside the pisiform, and I'm going to ask my patient to radial deviate her hand, and the triquetrum will pop into my finger. The next structure I'm going to be palpating is the scaphoid. I'm going to ask my patient to put her hand in neutral and to give me a thumbs up so I can find her anatomical snuff box. I am then going to ask her to relax her hand, and I'm going to ulnar deviate, and the scaphoid pops right into my fingers. The last structure I'm going to be palpating is the radial styloid process. I'm going to follow the radius down to the most distal portion of the radius, and then I'm going to ulnar deviate my patient's hand